essentially, practically any kind of doctor would be qualified to talk to people, to their patients about weight concerns. But especially, the family practice physician, internal medicine, OBGYN, for example, they often do discuss weight with patients, of course, an internist, and many of these subspecialties, orthopedic physicians. And when it comes to children, of course, the pediatrician is the best to bring out this concern, which, as you know, the issue of weight is much better addressed in children, so that way you set up a good guidelines. So when they are adults, they will have less likely to be, overweight. In modern practice, physicians spend very little time with the patients. In fact, they spend minutes with the patients, and physicians, doctors, are usually like to concentrate on the issue that you came in. So you came in with one issue, they want to address that issue, and that's it. But there is always an opportunity, an empty spot to say, oh, by the way, doctor, they take your weight. Patients' weights are taken in just about every business. They say, oh, they took my weight. How is it? Go a little bit prepared, and don't just settle for, oh, it's okay, or you're a little overweight, or you're a little. Just say, how is it? And you may also want to say, have you looked at my BMI? You want to prompt your doctor to give you solid information. Essentially, you want to start when there is at least some appropriateness. Hopefully, it'll be with your general physician, internal medicine. But any time is a good time, because many people, Latinos especially, have little access to healthcare, so they may not get an opportunity, down the line. But essentially, the best thing is to follow the BMI, body mass index. It's a chart that has height on one side and weight in pounds on the other side. You check the height and the current weight, and there in color, it tells the person whether they are normal weight, overweight, obese, or extremely obese, if that's the case. And a number is given, so that gives you an idea of how many pounds you have to lose to get back to what is considered a healthy weight. So it's very important, I think, for people to become acquainted with BMI even before they visit the doctor, so that they will be able to understand well, communicate, and they will be able to ask questions, more appropriately. Any visit, you get a chance to see a doctor. Now, if you have a more defined visit, so for example, if you have been feeling dizzy or tired or something like that, that's even the best chance. But just about any time is a good chance. It's a good time to talk to your clinician, especially when general health issues are being discussed. There are certain health conditions that are often go unnoticed for quite a while, which are the cause of the weight gain. So you want to ask the doctor, take the lead and say, is there a possibility that I have a health condition that might be causing this obesity or might be having gained weight? Because if there is, you want to address that health condition and then see how much, of that weight gain is attributed to that. There's a lot of discussion about weight, and especially in social media, about weight shaming, about what's acceptable. You have a lot of celebrities who are really overweight, and they, let's say, portray an image of being healthy, but the truth is that being overweight has consequences. Being overweight can lead to type 2 diabetes. can lead to heart disease, can contribute or can be the cause of high blood pressure. If we let ourselves be guided by just social media, we might reach the conclusion that, hey, it's not really a problem, but it is. It's not healthy. Culture is very complex, very complex, and very sensitive topic too. Latinos many times culturally have accepted as healthy and maybe even desirable a degree of weight which would fall into the overweight category and definitely into the obesity category in some cases. And that contributes to the high levels of diabetes, hypertension, cardiovascular diseases, and disabilities. I think that all of us Latinos should once again seek what is called, what is considered normal weight. The importance of maintaining a healthy lifestyle is so that we can live our normal lives, our normal length of life, or even live longer, obviously, but in good health and free from these disabilities that are preventable. Most of this increasing weight, this obesity in Latinos is usually due to we're not following healthy lifestyles, and so therefore these diseases that are linked to poor diets, to lack of exercise, are increasing and are causing significant problems in our community in general. That is a big problem because many Latinos don't have access to health care, don't have a regular provider that they go to once a year. In the meantime, Latinos should be alert for community health centers, health departments, the YMCA, sometimes libraries have seminars, have discussions about nutrition and weight in their centers. But Latinos can also search a great deal of good information with their smartphones, with their computers, but they have to be careful that they go to legitimate websites. Otherwise, they will be bombarded with contradictory information and in many cases harmful information. You want to go to sites that are legitimate, that they are by health agencies, by government health agencies that have your best interest in mind and are not trying to sell you their product or some other or some crazy idea there. Eventually down the line, if you are overweight, if you are obese, you do want to make an appointment to be sure that you don't have one of those health conditions that predispose to obesity, to being overweight.